I am proud of what we've been able to accomplish, and looking back to where we started back in 1990, I don't think you could have predicted that the program would be this big.
Welcome back to the Conemaugh Connection. Do you know the risk factors for heart disease? How about the signs and symptoms of a heart attack? While many experience crushing chest pain and shortness of breath, some do not. You're about to meet 3 people who had no idea they were having a heart attack. They're telling their story in the hopes of saving someone else's life, maybe yours. Johnstown Mayor Tom Tragona insists his job is not stressful.
Believe it or not, it's not as stressful as most people would think.
Extremely fit, the mayor works out several hours a day, a routine that often includes a 6-mile run. Heart disease was not on the top of his mind, but that would soon change.
I woke up in the morning with a pain in my throat, and I had no idea what the problem was. And 3 hours later, I was in intensive care. It was that quick.
Mayor Tragona regrets not calling an ambulance right away.
I wouldn't have made it if I had waited any longer. I just got there in time. I just never thought at all of the heart. I was expecting more chest pains or in the arm, but it didn't materialize that way. It was more in the throat.
An active, fit woman with 14 grandchildren, Sally Ann Pyle, thought she was having a gallbladder attack.
I just kept throwing up. Well, here I was having a heart attack instead of a gallbladder attack, and my arm started to hurt, and it kept getting worse, and I knew that I needed to get help, so I called my son to take me to Conemaugh.
Ladies, after they reach menopause, they do have a substantial increase in the risk of cardiac disease. And coronary artery disease is still one of the major causes of death among women.
In her late 30s, Sue Hall simply noticed herself slowing down.
I couldn't go to bed at night because my legs just hurt so bad. I would almost have to take something every night. I seemed to have severe teeth pain to the fact that I thought, I would need some sort of root canal. My joints in my hands were hurting. Just kind of regular walking, I would really be, short of breath, and my chest would burn. I guess I could describe it as my chest burning.
A stress test revealed a 95% blockage in Sue's left main artery.
I pulled out of my wallet pictures of my children and literally started crying. Just because probably all the bad things go through your mind.
But now Sue would be the first to tell others who need a heart catheterization to not be afraid.
Absolutely. Don't be afraid, because it'll probably be the best move you make for yourself and your friends and your family.
Statistics back up Sue's confidence. Healthgrades ranks Memorial among the top 5% in the nation for overall cardiac services. Number 4 in all of Pennsylvania for cardiology services.
There's no question that this is a better time than ever as a patient. Your options are certainly broader, and in general there are more things that can be treated in a cath lab than was the case in the past.
It is a great peace of mind knowing that right here in the backyard we have the best of the best.
While treatments have improved, so has the technology for diagnosing heart disease. At Myersdale Medical Center, patients now have First Pass.
First Pass nuclear imaging allows us to tell how well the heart is beating at rest and at stress, and adds additional information to the nuclear scan.
I think anything that improves the patient's test results would be a good thing. I want to keep the department up and going to the newest trends that we can possibly have to benefit the patients.
While much progress has been made, doctors say there's still much work to be done, especially when it comes to heart disease awareness.
In actuality, individual behavior is just stubborn. It's hard to change behavior patterns.
Because obviously the outcome would be substantially better if you prevent the disease from happening to begin with, or at least catching it, diagnosing it in the early phases, and delivering the appropriate therapy and prevention, rather than waiting until it's little too late.
Tom, Sue, and Sally all have risk factors. Tom, family history.
My dad had a heart attack at 60.
Sally has high blood pressure and high cholesterol, both now under control. And Sue?
Actually, I do have a little bit of family history, plus some contributing factors would be diabetes.
She's now a regular at Memorial's cardiac rehab. Just weeks after her heart attack, Sally was back to bowling with her team, the Big Dogs.
I'm just thankful that I can do everything I can do.
Now, back to the lives they love, all three also have one other thing in common: a desire to get others to pay attention to their hearts.
Don't wait. I think that's where I made my biggest mistake. I waited. If I would have gone earlier, I would have been in much better shape.
You can take care of yourself and feel 20 years younger like I do.
If you have any symptoms, go get checked out right away, because the quicker the better, I think.
How can you prevent heart disease? Just follow these 5 simple steps. Don't smoke. Get active. Eat a heart-healthy diet. Maintain a healthy weight. And get regular health screenings. The Conemaugh Health Foundation can help you with the last step. They're teaming up with Edward Life Sciences to provide free cardiac screenings. For more information or to sign up for the upcoming cardiac screenings, give the Conemaugh Nurse Connection a call at 1-800-587-5875. That's all the time we have for this edition of the Conemaugh Connection. We want to thank all the nice folks who allowed us to tell their stories. And thank you for watching. From all of us in the Conemaugh Health System, we wish you good health.